Welcome to the Community Coin blog and Coin News channel, where we talk about all things social, economic, health, self-help, and wellness. We are all about helping people to live better lives through learning and information. Today we're going to be talking about homeopathy, which is one of the most interesting subjects when it comes to health, because it is one of the few ways to actually restore health in a person that is not healthy. And unfortunately, this is something that very few people have heard of or know anything about. Most people, when they hear the word homeopathy, they think things like herbs and supplements, but that is not what homeopathy is. Today we're going to find out just exactly what it is and how it can help you. Homeopathy is a specialty of medicine that's been around since 1796, when it was discovered and explored by a physician at that time by the name of Samuel Hahnemann. And he discovered it because he was, in addition to being a physician, a translator of texts, especially medical texts, and he was a chemist. And he was translating some old medical texts and came across the idea of similars curing similars, meaning that if you have a stomach ache, that in the old Greek medical tradition, you would take an herb that would cause a stomach ache, but take it in a small amount, and that would cure your stomach ache. And he was, at the time, very dissatisfied with the way that the medical system worked and the way that medicine was practiced, and so he stopped practicing medicine and worked full-time to support himself and his family as a translator and a chemist. And he believed that there was a better way to treat illness and prevent illness and restore health. And when he came across this idea, he ran with it. There basically are two main ways that homeopaths practice. And these two are classical or constitutional homeopathy and acute homeopathy. And we're going to look at both. In classical or constitutional homeopathy, we look at the person in their entirety and try to understand the imbalances that may be present in their body, mind, and spirit, and use those imbalances to paint a picture of the overall state of being. Each person's symptomatology points to their condition being one of many particular remedy states. By finding the state of the person's being at that particular moment, and by giving them the remedy that corresponds to that particular state, we are able to bring the person back into balance, thus improving their overall health. Many people believe that a person may see not only the elimination of long-standing health problems when they undergo treatment with constitutional or classical homeopathy, but also may find that they are more resilient to future health problems because their overall state of health has been restored and they're better able to fight off illness. Some also believe that if an acute illness arises, simply giving the person their constitutional remedy will quickly bolster the body's abilities to fight that off. It's thought that illness, whether of the body or mind, is able to take root or develop only if there is a state of imbalance. If we are able to restore the body and mind to balance, then illness and disease may not be able to take root and develop. Now, in acute homeopathy, one uses homeopathic remedies in a short-term acute situation. The person's constitutional remedy should be used first in most cases, rather than using an acute remedy, but temporarily an acute remedy can be added when needed. For example, if a person sprains their ankle, a dose of arnica may prevent swelling and pain. Acute remedies can be very useful, and most people that use homeopathy use the remedies acutely. They have a sinus infection or bronchitis or a broken bone or whatever, and they treat that acutely with remedies, and that is a very good thing to do when something happens or develops that needs to be treated right away and you don't know your constitutional remedy, or in the case of like a broken bone, we wouldn't give the constitutional remedy to begin with, we would just use an acute remedy. But treating only acutely has the problem that it doesn't have the goal or the aim of restoration of health. It's only putting a Band-Aid on an acute situation. And like I said, that's fine when that is necessary, but it's very important that the person always follow that up with constitutional treatment. Homeopathy, in today's terms, might be considered a sort of physiological process modulating therapy. It's believed by some that what homeopathy does is to trick the body into action against the illness state by amplifying the illness condition to the point that the body starts paying attention and taking action by correcting the malfunction and restoring the proper functioning of the body by using what is called the law of similars. And we talked about that a little bit earlier. But what that is specifically is what is exactly what the law of similars is the meaning of homeopathy, which is homeo means same and pathology means illness. And so the reason it was named that is because of the law of similars. So if you give a minute dose of a substance that in a healthy person could cause symptoms similar to the ones being experienced by the sick person, then that's what homeopathy means. Now, this amplification actually takes place on an information level rather than on a physiological level. Thus, it does not cause an actual aggravation of the symptoms or worsening of the illness, although a homeopathic aggravation is common, and that can be a good sign or a good thing. On the contrary, some believe that the properly selected remedy may alleviate the symptoms quickly without any untoward effects to the person or being. One might describe human physiology in a simplistic way as having essentially 3 processes within the body that regulate body function. The first process is the software process, or the DNA and the RNA. This is the computer code that tells everything in the body what to do. Then there is the hardware process, or the organs and tissues. The organs and tissues are the end product of this process and carry out the instructions that were originally written in the genetic code. But then there's a third process that is in between these two. This third process is the chemical, biochemical, and energetic modulating processes. it's within this third process that we believe that homeopathy does its work. There are some that think that the properly selected remedy can introduce information into the third modulating process in between the software and the hardware, and sort of rewrite or reprogram the information and cause the hardware, meaning the organs and tissues, to function differently than they would have otherwise. It is thought that perhaps by introducing modulating information into this third space, or this third process, we can rebalance the organs and tissues' function and cause them to function more correctly, or in the way in which they were designed to function rather than the way that they're currently malfunctioning, thus causing the illnesses and diseases to melt away. Whether this is the actual biochemical or physiological process in which remedies work is not known. However, homeopaths can all agree that the properly selected constitutional or even acute remedy somehow seem to bring about better balance and function in the body and mind. Homeopaths have always talked about this in the sense of strengthening the vital energy and correcting imbalances in the vital force, and this may be a perfectly satisfactory way of discussing it. But regardless of how it works, many believe that it works very well. In the current medical world of pharmacological assault on the delicately balanced ecosystem that is the human body, a more elegant approach that stimulates the body to simply do what it was designed to do rather than assaulting an already unbalanced system with further toxic assault is certainly a very interesting idea. Many experts have recently claimed that we are quickly approaching or are already in a post-antibiotic era. This means that over the last 70 years we have abused the use of antibiotics to the point that bacteria have become so resistant that antibiotics are becoming ineffective against many infections. If it were possible, wouldn't it make more sense to just stimulate the immune system to do what it was designed to do and have it kill the infection rather than use chemicals that are not only creating antibiotic-resistant organisms, but are also causing further imbalance in our bodies? In terms of antibiotics, just as an example, if you have a sinus infection, the real issue is not that there are too many bacteria in your sinuses causing problems. The real issue is that your body is not handling the environment in the sinuses correctly. And if it were, then there would not be the overgrowth of bacteria and the excessive accumulation of mucus, providing a wonderful environment for those bacteria to grow. If your body were doing things correctly, the sinus infection wouldn't happen. Or if it did start, the body would quickly resolve it. So if you have a sinus infection, for example, the problem is not the overgrowth of bacteria or the excessive mucus. The problem is that the body is malfunctioning and allowing that to happen. So the more reasonable treatment is to figure out why the body is allowing this to happen and fix that. And then the sinus infection would just go away because the body would start functioning again. And that's what we're talking about here. And this idea, perhaps, can be applied to any human illness. Why assault the body unnecessarily with toxic chemicals that cause more imbalance and illness when we may be able to simply correct the imbalance that was causing the disease in the first place? Wouldn't that make more sense? Wouldn't that be more reasonable? I mean, we can apply this to diabetes and high blood pressure and autoimmune diseases. I myself had the worst form of rheumatoid arthritis, and when it started, it started deforming my hands so quickly that the rheumatologist had me on everything imaginable. And when I decided that what needed to be done was to fix the underlying problem rather than just try to kill my immune system, I turned to homeopathy, and by the grace of God, I no longer have the symptoms of rheumatoid arthritis, even though the gene is still there. This idea of fixing the underlying problem rather than just suppressing the symptoms is a very important idea. We are facing epidemics and pandemics of human illness, and perhaps we should no longer solely rely on what many believe to be a faulty model of chemical assault against the body. Perhaps we should look at transitioning, at least in part, to a more elegant and reasonable approach. It would seem only reasonable to explore the use of homeopathy and proper diet, exercise, disease prevention, and other things in appropriate ways rather than just always relying on pharmaceutical drugs. I always say be proactive rather than reactive, or as Benjamin Franklin said, an ounce of prevention is worth a pound of cure. We have to be more proactive rather than relying on reactivity and the quick fix of chemical assault or pharmaceutical drugs, which ultimately many believe just cause more problems and make us sicker. It is potentially just a vicious cycle, giving a drug to treat a symptom or a disease which causes yet another symptom or disease. Treating one imbalance by causing another, ultimately just making us sicker and sicker. Pharmaceutical drugs do have their place, but perhaps we should also start looking at disease and illness in a more reasonable way. Perhaps we should start to look at treating the problem rather than just covering up the symptoms. Many believe that until we start looking at the causes of disease, not just the symptom management, we'll just keep digging ourselves into a deeper and deeper hole until at some point the hole has become so deep that we can no longer get out of it. Perhaps everyone, and especially medical professionals, should start thinking about disease differently before it's too late. There was a 19th century physician named John Ellis who said, "We all admit that everyone who attempts to act as a physician should strive to qualify himself or herself to work by obtaining the best education which our medical schools afford. For the physician is entrusted not simply the property or money, but the very lives of their fellow citizens. As the responsibility is great, so the duty of preparing oneself before commencing practice and of keeping fully abreast of all new and valuable diversities or discoveries in the art of healing is equally great. A physician should not be led blindly by his teachers and prominent medical writers, and so strongly confirm himself in the theories and views which they proclaim that he cannot, without prejudice, examine new views and theories with due care. The treatment in allopathic medicine consists largely in giving and applying remedies in disease-creating doses and the use of remedies that directly or indirectly reduce the inflammatory or febrile action. But it is manifest that while it may lessen the activities of the diseased symptoms, it also lessens the vitality of the system as a whole, and consequently its power to resist and overcome the existing diseased action, so that it is a serious question whether in many cases more is not lost than gained. To create disease of a well organ for the sake of curing disease in another organ, as is done though the patient may sometimes be benefited, is certainly not a very satisfactory treatment as a whole. But the great danger and evil that results from allopathic treatment of disease lies not in the direction of the sudden deaths that sometimes result from the use of its remedies, but by the liability of the patients to be led into habitual use of a drug that has afforded them palliative relief during sickness, and the countenance thus given for the use of such drugs by the laity during health. And they may believe that, as a rule, poisonous substances will palliate the symptoms which they caused or which follow their use. One of the great beauties of homeopathy lies in the fact that when correct remedies are given in accordance with the law of cure, they do not have to be given in disease-causing doses. This was written in the 1800s, and it's amazing that this physician understood this idea, and exactly what he was talking about is even more prominent nowadays because our modern society is a pharmacology-based society. Everything that we think and do related to health is pharmacological. If you have allergies, you go to the grocery store and get allergy pills. If you have an upset stomach, you go to the grocery store or the pharmacy and get something for your upset stomach. If you have acid reflux, you go get a pill for that. Everything that is wrong with us physically, mentally, we go and get a pill, whether over the counter or by prescription. If you're depressed, you take a pill. If you have rheumatoid arthritis, you take a pill. If you have an upset stomach, you take a pill. No matter what is wrong, you take a pill. And that is just not the right mindset. A contemporary physician who practices homeopathy said, "We see disease as the disattunement of the dynamis or vital force, which will show up in the person not merely in one locale, but may manifest in diverse manners that may not seem to be related to each other from the perspective of reductionist pathology. As such, a person presenting with athlete's foot, gastroesophageal reflux, and a headache may have 3 separate diseases according to allopathic nosology. But for us, there is likely one disease in the person manifesting simultaneously in these 3 superficial expressions. Homeopathy addresses the individual case of disease as it manifests diversely in the whole person rather than pathologically define diseases as things in themselves." And this just seems to make so much sense. And I would encourage everyone to rethink their thoughts about health, rethink their beliefs about health and wellness, and rethink what it means to be healthy. Health is not just an absence of symptoms. Health is not just an absence of pain. Health is not just an absence of suffering. Health is something deeper. It's deep down inside us. Things are working correctly. Health is not about not having symptoms, or if we do have symptoms, cover up the symptoms or suppress the symptoms. Health is about restoring proper function to our bodies and our minds. So I encourage people to stop thinking in terms of just suppressing and covering up your symptoms when you have them. Start thinking rather in terms of fixing the underlying problems so that whatever is not working properly is now working properly, and then the symptoms go away because what was causing them has been fixed. If you found this information interesting, there is so much more information available at the blog, thecoinblog.com, coin spelled with a K, and the blog post that we're talking about today also has some links that can take you to even more information if you want to take a deeper dive or go down that rabbit hole even further or deeper. So I hope that you check out the blog post, and I hope that you seriously reconsider your thoughts and beliefs about what it is to be healthy. And we will talk to you again next time.